It is the rhythm of the city, 94.3 WYBC. I am Wanda Coppage. As I told you before, we're going to be meeting with many coming from Cornell Scott-Hill Health Center in regards to COVID-19 and everything we want you to know. Today, we're focusing on the children, our children. We have Dr. Meredith Williams here. She's Director of Pediatrics at Cornell Scott-Hill Health Center. First, let me say good morning to you. Good
Good
morning.
morning to you as well.
So let's jump right in. I know you know the conversation, the discussion surrounding the reopening of schools. Should we do, should we not? I believe it was yesterday at the time of this taping, it was yesterday that the meeting happened between the New Haven Public Schools and the State Board of Education. What are your thoughts and your feelings on the children returning back to school safely?
So I feel like we've been working on the children's safe return to school really since school was shuttered in the springtime for the pandemic. The State Department of Education has been working along with the Office of the Governor and has issued a document that gives a very detailed plan to consider the educational needs, the public health needs. It is the basis for districts to plan their reopening. It balances health, safety, equity, access for all students. It's a fluid document. It has multiple scenarios in it, has many contingencies, and has actually already been updated once in the beginning of August. And it's basically the template for the local districts to develop their plan to reopen safely. There are school medical advisors. Each district over a certain size of students has a school medical advisor, and that is a physician who is sort of the medical representative for the school. And that group of medical advisors has been working also along with the State Department of Education to help the school districts develop a plan that would be safe for their students to return. So yes, I feel like reopening is a positive thing for students. I feel like there are many benefits to school. Education is really only one of them. There are so many social needs. There's emotional needs. There's uh, nutritional needs. The needs are diverse and really span far wider than just education and learning. So
Yeah.
I feel very strongly that reopening is a positive thing.
I would have to I agree to a certain extent because I do have a son and he needs to get back into the classroom, needless to say. But the concern of many of the staff, the teachers, the parents is that are we able to do it safely? So are you the motion that was passed from the board, our local board, was to delay it for 10 weeks, have the first marking period done all remote, no choice for parents. And then our superintendent of schools would like to have the hybrid model put in place. So you are saying that you are for the hybrid model, get the kids back in the classroom, and you do believe we can do it safely.
Yes,
Okay.
that is my position. I believe that a hybrid model would support both. It will take into account both the public health needs and the educational needs, and it would give us the opportunity to at least try to see how those two things will line up. And certainly, obviously, if we discover and that public health puts us to a point where we feel that is no longer safe, then clearly then changes will be made. I don't
Right.
think that anyone feels that anything that we decide today is going to be something that we can guarantee will work for us long term. This is a very fluid, very, very fast moving target that requires us to think about it on regularly, and changes may be made. But the change could possibly be made to realize that we can go back to school safely full time in person too.
Yeah.
I don't think that the only change that we're anticipating is that we will shut down.
Well, what about as you're well aware, there are different students entering different grades, then that they have to get physicals done. They have to have a physical before they return back to school. And I know from personal experience, the waiting list is ridiculously long because doctors' offices are not operating as they would normally function during these COVID-19 times, what would be your recommendation on getting the physicals, or how do we navigate through the loopholes right now?
So I think that doctor's offices certainly, the August would be a difficult time of year, no matter what was going on, right? There's always quite a push for the children to get back to school and for them to get their physicals and things like that. I think that doctor's offices are, everybody I feel like at this point is back operating. We in the office, we're prioritizing who are the students that absolutely must have a physical in order to enter. And
Right.
there are some students that is the case, and so they are receiving priority over those who can go to school and may be able to get their physical in September or October just as safely. So I think that with just some forethought and planning and sort of the internal prioritizing of those who absolutely must have versus those nice to haves, we can certainly make accommodations for everyone to get what they need.
What do you feel about, we already spoke about the testing, I mean, the students returning back to school, and you think that that can happen safely. What are your views on children being tested for COVID-19 upon the return of school, prior to the return of school?
So I don't think that children need to be mass tested upon the return of school, but in any way. I feel like this is a school year where we are really going to ask parents to monitor their children, to be sure that they're sending a healthy child to school every day who feels well and is free of symptoms and is ready to learn in person. With a mask on. We are certainly going to require that our students in person are wearing masks. And if there are any concerns about the health of your child or symptoms or illness, parents should be consulting their providers and seeking advice as to what they need to do to move forward, whether testing is the issue or whether it's just to watch and wait for a day or two just to see how the symptoms declare themselves. Maybe it's not COVID. There are still other illnesses out there besides that.
Well, but in regards to the testing, if there are individual families who say, I know it's not required, you just want me to keep an eye on my child, but I think I would rather know that my child does not have COVID-19 and I want to get he or she tested. What advice would you have for parents that want to get their children tested? And will there be a different test for a child versus an adult?
So my advice would be for anyone that has concerns about the health of their child to consult with their provider and seek their advice and follow their recommendations. Testing for children is exactly the same as testing for adults at this point. The test is still the test, and the methods are no different for children. Here at the Cornell Scott-Hill Health Center, we have two testing sites. We have one at our Columbus Avenue location and another at our Dixwell Avenue location. Mm-hmm. So if a provider recommends that a child needs a COVID test, they are certainly welcome to use our site. Anyone is welcome to get testing at either one of our sites.
Awesome. This is Dr. Meredith Williams from the Cornell Scott-Hill Health Center. Before I go, was there any last words that you wanted to give in regards to children, COVID-19, or anything we need to know?
No, I'm looking forward to the children going back to school. I think that it is one part of promoting the health of children in our community. I want to encourage everybody to stay safe. I feel strongly that everyone needs to be wearing a mask, washing their hands. And if you have any symptoms or any concerns at all, consult your provider and stay at home until you figure out what you need to do going forward. Just stay safe. That's my advice.
Stay safe, be well, wear your mask. That's what I tell people all the time. Again, Dr. Meredith Williams, Director of Pediatrics at Cornell Scott-Hill Health Center. I want to thank you for your time. And is there a contact, any email address that you wanted to give to anyone if they want to speak to you directly or contact you at Cornell Scott?
Sure. You can reach anyone at Cornell Scott-Hill Health Center, is reachable at 203-503-3000.
Awesome. It is the Rhythm of the City, 94.3 WYBC. I'm Wanda Coppage. Stay close. More on the midday edition of The Workforce. More great music and more great talk. Keep it locked.